Hi YouTube people, this is Sonia on my surgery eve. I am getting ready to go through a bunch of products and just preparation, pre-op diet through the night before, what I'm going to bring to the hospital. And I've never really done this while I'm holding the camera, so bear with me. And I'm probably going to be piecing some clips together as I go. So I'm wearing the shirt, the shirt that I wore on my very first video in honor of my surgery eve. Anyway, so let me get started. I'm gonna have to turn this around, so hold on. Hey everybody, this is Sonia with SMC VSG 2016. It is Saturday, October 8th. I had my surgery on Wednesday, October 5th. And I am up and ready to do a video to show you what I brought to the hospital and actually medications that I got before going to the hospital. So I didn't want to make this a really long video, but I'm going to be making another one that's talking about pre-op and post-op liquid diet staples, I should say, that I got. So for now, I'm just going to focus on this. Okay, so the medications and then what I brought to the hospital. So I went out and purchased this generic Miralax before I went to the hospital because I hear so many people talking about constipation, and the struggle is real because I think my last bowel movement was 2 days before I had surgery, which, let's see, it's been 3 days, so 5 days now that hasn't happened. I also took a Dulcolax today just to I've taken the Miralax yesterday and today. Anybody have any tips on that, please leave them in the comments section because I could really use it. I'm a little worried about that at this point. So help me, please. This right here is the generic Levinox, which is the shot that you give yourself for blood thinner to prevent blood clots. And although I was low risk for that, and actually the doctor acted kind of ambivalent about whether or not I actually used it. You know, I just figured better safe than sorry, and it was $10 copay in my insurance. So I've been giving myself a shot in the stomach for the last 2 days of that. These little alcohol swabs go with that. This is the only medication that I brought with me to the hospital, and that's my blood pressure medicine. And the only other medication I take were vitamins and supplements, probiotics. Which I did have my probiotics over here. I don't know what I did with those, but I was taking those right up until the day before surgery. This Nascobal, I really want to talk about this. They told me, my dietitian told me about this program that this company has where if you purchase their intranasal B12 spray, which is this, that they will supply your necessary vitamins after bariatric surgery. And you can see that they do. I have the Berry Active multivitamin, calcium D3 plus magnesium, and then the iron plus vitamin C. Those are all chewable forms. I got that for the first month, but even though my copay is $50, they only charged me $25, and it will be $25 a month. I have it set up for automatic payment because I think that's a really great deal. These would have to be pretty nasty tasting for me to decide to do something different. Plus, they mail them to you every month, so you don't have to worry about remembering. It's just all around for me and my lifestyle. It's a good deal. So they also have, you know, regular vitamins that aren't chewable, but I figured for the first month I should go with the chewable. These medications over here are the omeprazole, which is for, you know, acid reflux, if I have it, which I haven't yet. Of course, I haven't really eaten anything. The other one is the generic Zofran, and then there's another generic for Actigol because I still have my gallbladder. So my doctor recommended I take that medication, I think, for 6 months to prevent gallstones. And I was like, okay. They also gave me that pill crusher, which, you know, if these multivitamins do taste nasty, I might just crush them up and put them in with, you know, my protein shakes or smoothies that I make. So those are things that I purchased before surgery. Over here, same thing. The Preparation H Totables. That was someone's recommendation on a video that I took. I haven't had to use them yet, and I didn't bring those to the hospital with me because I figured there would be no bowel movements happening there. But I don't rule it out, especially since, like I said, it's been five days at least. Gas X strips, I did bring them with me to the hospital. Yes, I did. Yes, I know that they don't work on abdominal cavity gas. However, you know, it couldn't hurt. And that peppermint flavor in my mouth, which is super dry after you have the surgery, was nice. It was nice to feel like I had a clean mouth. That makes sense. And I took that, and they also gave me the simethicone drops. And I also, as you can see, took Esther's VSG Trek. Esther, I took your advice and went out and bought a heating pad with this super soft cover. And I did use it in the hospital. They did let me plug it in, and it did help. So I was really prepared for that to conquer that gas pain, and I didn't have any. And I think it's still coming out, but I think mine stayed localized to my abdominal area. So I didn't have it moving around and causing me problems other places. Here's another thing I took to the hospital, Smart Water. Again, these, all of you making videos for people, thank you so much. And that's why I'm doing this, because all of these ideas I got from watching other people's videos. Excuse me, this anesthesia coming out is causing me problems with my voice. Smart Water, because it has electrolytes in it, and that's something that's really good for you after having surgery. And if that's all you can really drink, it's better to have this type of water versus plain tap water. There's the spirometer, which is your respiratory therapist will go over this with you before you have surgery, but it's something you have to use after surgery to get that anesthesia moving out of your lungs. And I've been using that every day, and I took it with me and used it in the hospital as well. I brought this heavy-duty skin lotion with me. What other kind is there? I don't know why I said skin lotion. Okay, so I smeared that all over my face, heavy-duty, before I went into surgery, and my face did not get super dried out. Surgery can also dry out your skin a lot, so that's why I brought that. Here's my little Ziploc bag. I honestly did not bring a lot of things to the hospital. That's got my toothbrush, toothpaste, my mouth moisturizer, some alcohol swabs, which, by the way, if you do have nausea, that was someone's suggestion. Pull open one of those babies and hold that alcohol underneath your nose, and it will make that sensation go away. And I did do that a couple times, although my nausea was super minimal, but I think it did help. I also have eye drops in there. Speaking of that, I forgot to talk about another medication that I took before surgery, about 3 hours before surgery. My doctor recommended a medication called Emend, which is something that is used by people on chemo to prevent nausea and vomiting. So I had that as well as the patch behind my ear, and I really had, my nausea was practically non-existent. I think I might have had a couple times where there's just a little bit of feeling of that, but nothing to write home about. And so that pill cost $50 with my insurance. So I'm just going to tell myself that that's why I didn't have it, because otherwise that would be a waste of $50. So I got it. You might want to ask your doctor about it. I also took a journal. I took my folder that's got all my pertinent surgery, pre-surgery, all of that information in it. My cell phone charger, a hairband so I could wash my face, and a hair clip. Those all went to the hospital. And then I also brought my own nightgown and the clothes that I wore home, which these are like super loose yoga pants, these black ones. Super comfortable. They're like this silky material, but they're not silk. They're like, and they're real loose around your belly. And this, as you can see, that is a sports bra that I bought, that I brought. That was really comfortable. I liked having my own nightgown. I also brought my little slippers. So, and it's a good thing because they didn't give me, they did not give me any of those non-slip socks, which was a little bit annoying. You just got to see my cut off, our floor is being completely redone in this kitchen. So I think that's pretty much it as far as what I took to the hospital with me. Like I said, it was minimal. I would suggest not taking a whole bunch of stuff because you're not going to need a whole bunch of stuff. They pretty much have what you need. Okay, I'm going to end this video. I have another one coming, like I said, on the pre-op and post-op diet. Take care, everybody.